My name is Ijoma Obonia, a DMP student of Bradman University. I am going to discuss about my CSP project. My CSP project is basically about examining whether the use of professional interpreters will enhance medication compliance in diabetic individuals 50 to 75 years of age who are resident here in Los Angeles, but Hispanic population. Stakeholders in this project are going to be the patient, insurance companies, who are the financial stakeholders, nurses, providers, support staff, and professional interpreters as well. The role for each of these stakeholders will be discussed now. For the insurance company, they will be providing education as to why this should be implemented. They will also be examining the cost and benefits of this project and criteria employed for inclusion and exclusion of patients that will be receiving these provider interpreter services. For the nurses are going to be like the support staff, and they are going to educate the patients about significance of this project. They're really going to educate the patients about their rights and let them know about their rights as a patient, and educate them about the significance of having professional interpreters. The providers are going to provide answers for patients' questions. They are going to act as advocates, and they are going to make approval for eventual protocol. The professional interpreters, on the other hand, are going to do no harm. They're going to do exactly what is beneficial to the patient. The professional interpreters are already trained, and cannot interpret like family members, like putting into consideration their culture and the relationship. They're going to say whatever the patient needs to know, which the doctor has determined he has to let the patient know the way it should be said. The theoretical foundation and conceptual framework. The main purpose of this, or the goal for this project, is to promote use of professional interpreters in healthcare settings. According to Mosaics and Bowen 217, language barriers generate the need for using third parties to facilitate communication between patient and provider. The theoretical foundation incorporates and integrates individual experiences, cultural norms, and cultural beliefs. This project is supported by transcultural theory, which postulates that effective healthcare involves knowing and understanding the various cultural norms and beliefs related to patient. Healthcare providers need to provide transcultural care, which is patient-centered approach and is culturally unique based on effective communication. A meeting of a team from different disciplinaries will be employed to present the project idea, capitalizing on evidence-based research to support the project, delineating the cost-benefit analysis, plans for protocol development, plans for development and implementation. In this regard, we will have an open debate for feedback subsequent to the presentation, specifically concerns will be deliberated upon. It shall be brought forth in the course of staff meeting for all stakeholders involved in the project. In conclusion, care delivery processes are characterized by interactions between different stakeholders. Therefore, effective communication is an essential component for achieving desired patient outcome. Collaboration between all stakeholders will help improve the project effectiveness and results. References are outlined. Thank you very much for listening.